Where are you and what are you doing?
I'm in New York City. I'm at Bellevue Hospital. Bellevue is the oldest hospital in the country. Um, and I'm working working in respiratory. So that's all the patients that are on ventilators. That's all the patients that are about to be put on ventilators. That all the airway stuff. That's what I'm doing.
Um, and tell me what it's like. Tell me what you've seen.
So just to give you some statistics, I guess like 90% of the hospital is COVID patients. Um, we are currently using 85 ventilators um, here, and so that's 85 people that are intubated. We also have a lot of people that are on what we call ECMO. It's EVMO. It stands for extracorporeal membrane oxygenation, um, and it's basically like a heart-lung bypass machine. And that's kind of like their last-ditch effort to keep people alive. There's a very limited number of those machines, so all of them are in use. Um, we have a lot of people that are on continuous dialysis. Um, and all the units have been turned into COVID units. There's probably only, I don't even know, 10 people, 20 people that do not have COVID in this hospital. And they're the cardiac patients, trauma patients. So they're separated from everybody else. But like the endoscopy suites, the recovery rooms, med school classrooms, conference rooms have been turned into COVID rooms.
Wow.
So, I mean, and they're everywhere. And people die every day, um, left and right. And sometimes there's not much you can do to help them because you don't want to aerosolize the virus. So you kind of don't really help for very long, which is always kind of sad. I was surprised at how, because all the media says it's old people. It's not. I mean, it's a lot of people in their 40s, 50s that are intubated, mostly men. I haven't seen a whole lot of women with it. I feel like the females are older females, but the men are like I'm 40, so there's been plenty of people that I've treated that are my age. Um, and it's just like, it's unbelievable. So,
So, how long are you spending in a patient's room at a time or with a patient at a time?
so you want to only go in there once. Like you don't want to have to go like in and out, because all the rooms are negative pressure. At St. Vincent, I mean, we're well stocked there. Like if you need something, you can find it. Here, probably the majority of people that I have run into are travelers. The staff is so exhausted that they've just brought in a bunch of people to travel to work here. I have to go.
Okay.
I will call you back though.
Okay, thank you.
Bye.
Bye.
Everybody there's so many travelers from everywhere. So if you're like, hey, I need to find this, they're like, I don't know where it is. Like there's very few people that are currently working that actually work there because the staff has just been they're so exhausted. So that's why they're bringing in all these travelers, like travel nurses, travel physicians, travel everybody. And then there's also people that are in I saw a pediatric oncologist today working on the COVID unit. So, I mean, all these people that are in other different areas that are brought over to the COVID units to work, and nobody knows where anything is. I asked somebody, hey, where was I trying to go? I don't even know. One of the units, and they're like, I have no idea. And they're like, I'm just traveling. So it's just kind of everyone, it's almost like the blind leading the blind, because everybody's a traveler. I mean, everybody is working as hard as they can, and I mean, everything's getting done. It's so different from any environment that I've ever been in.
So,
because again, most people, like, I needed more gowns today, and I was like, hey, where's the gowns? I don't know. I had to walk around for, I don't know, 10 minutes until I could find somebody that actually worked there that knew where stuff was.
wow.
And they helped me find the gowns. Just little things like that, where are the gowns, where are the gloves? Does anybody know where this is? Does anybody know where that is? And it's just like, where is this patient? I don't know. It's just like, it's kind of, I don't know, but I mean, like, everyone's working really hard, and the hospital is, everyone's amazing. It's just, we're all just kind of flailing because we're all just new, and we're all, I don't know, I mean, it's like anything when you start a new job, but it's like if the entire hospital started a new job on the same day, kind of.
So is there any like lack of equipment or lack of PPE or anything like that?
No, we have, so in order to get your PPE, there's like a checkout desk where you have to get one, and you have to, so you have to like show your badge, and you get, but it's on the ground floor, and if you're like up on the 14th floor and your mask gets all messed up, you have to like stop what you're doing, go all the way downstairs, get a new mask, go upstairs. But no, we have all our PPE. We have adequate ventilators. I know the government donated a bunch of ventilators to us. So we have plenty of ventilators. At one point, they had 180 people on ventilators, and that's kind of when they were struggling. But now, I mean, people are, I would probably say more people from people that were on ventilators, more people are probably dying than going home. But we have ventilators now.
And since you've been there, how many people have gone home? You've been there for what, 3 days now? Today was day 3?
Yes. So it's kind of cool. They play.
Don't Stop Believing.
Don't Stop. Yeah, I suppose that. Same thing. So, but I've only heard it once.
Wow.
So, yeah, I've only heard it once. I've been there, but that doesn't mean. I mean, that doesn't mean people that have gone home. Like, if I haven't heard it, but
right.
I know that we haven't discharged anybody in the past 2 days since I've been there.
Is there anybody who would be close to discharge?
Well, so I'm in respiratory. So we manage the ventilators and people that are on any kind of respiratory support. So our people, no. There could be other people on other floors that don't need respiratory support, but just were kind of sick, that are going home, that might be going home, but nobody that we take care of, because everyone we take care of needs at least oxygen up to ventilating.
Yeah.
And ICU care,
So tell me what your typical day looks like.
Yeah, so this morning, we get there, we get our assignments, we go do our event checks. So we have to go to everyone that we are assigned. Today I had 6 patients on different floors, and some of them were in our non-COVID unit, which was kind of nice because you have to wear like all your stuff. It gets really hot, and I don't know, I mean, you can't really see it, but I like have bruises on like here and here on my face. So we get our assignments, we go do vent checks, we do trach care because there's some people that are already have trachs. Then, so I carried the airway pager today. So whenever, and it's kind of confusing for me because I've always been in the position where I manage the airway, but now they have like an airway team, and they have a code team. So when those things happen, my role is to get the ventilator ready for whenever they intubate them. Usually I'm the one doing the intubating, and someone else has the ventilator ready, but now I'm in the role of getting the ventilator ready. So I had their airway pager. We had to take 2 patients to CT that were, one was intubated, one was on a trach. It's just like someone was going from high flow nasal cannula to BiPAP, and then another person was going from, it's just like different levels of respiratory support that they need. So every time someone either gets a little better or a little worse, we have to go take care of that. And so that was kind of like the majority of the day. And then we had one code, or I had one code that I responded to, and then we would like go back around for our original patients to check them again. But sometimes, like the one code that we have, I mean, I was working on him for like an hour and a half at least, maybe 2 hours. So that was long.
Yeah. That's 2 hours of CPR, right?
So
is that 2 hours?
No, not CPR.
Okay.
Coding. Well, when we say code, it's not like their heart rate stops. It's more like a respiratory code.
Gotcha.
So he had been kind of circling the drain all day, and then 2 hours of CPR, no one would do that.
Yeah, I didn't think so.
Actually,
that sounds like torture.
Most patients, like, we don't want to code them for a long period of time because it aerosolizes the virus. Well, I don't think there's very many that are intubated here. I mean, obviously only one person has died in Vanderbilt County, whereas here it's like in New York City, or in the state of New York, it's like 450 people a day. Well, I think today was like one of those, the second day in a row that's been under 500 or something like that. And like, it's like a ton of people every day. And I don't even know how many people died today in the hospital. Like, there's just no telling. A lot. But how is it different? Well, all these hospitals are teaching hospitals. And then also, again, like I said, everyone's a traveler. So it's not necessarily disorganized because everything gets done that has to get done. It just almost seems like most people are flying by the seat of their pants. Whereas in Evansville, like everybody knows what they're doing and where they're going, and it's a little just more routine and organized. So, I mean, like, when you have residents, you just have people that are learning all the time. And then when you have a bunch of travelers, you have people that are learning all the time. So everyone is just a little bit different in everything they do. So there's that. I work in the ER as well, and at St. Vincent as a pediatric nurse practitioner. And we don't have we haven't had any kids, I don't think, that have been positive. But we have our separate COVID area, and it's like very like organized about to how everything runs. They have someone that checks PPE. They have someone that, you know, someone walks in that may have COVID. They go into the COVID. It's just very organized. Whereas, and we don't have very many people up on the units that are intubated. I don't think that could have changed in the past couple of days. But the nurses that are taking care of those people have been there for forever, so they know where stuff is and how things go and all that stuff. Whereas here, it's not like that at all.
Yeah. So tell me exactly why you decided to go in the first place.
I don't know. Right now, I'm questioning that after today. Well, I'm a CRNA and I'm a nurse practitioner, and I don't go full time on my nurse practitioner job until it's supposed to be May 1st. So, most of this month I was not really working, and as a CRNA, I'm not working, and I could help. Like, I just felt like I had to do something to help. I love New York City. I have friends that live here, and they're working. One friend is working at NYU, and just I can help. And I almost just felt like I was doing nothing in Evansville when I knew that I could be doing something. I don't know. That's just, I felt like I could help. That's it, really.
So what's the plan for when you come home? When do you come home? Are you going to self-isolate for 2 weeks? Or?
I come home May 1st, and I've kind of been asking around, like, what other people are doing. Because, again, I mean, I work in an ER environment at St. Vincent, so at the same time, I could be exposed too, because there, a lot of kids that may have COVID don't really have symptoms. So it's kind of like, we know there's community spread of COVID. So is it really worthwhile to self-isolate when you could get it from going to Schnucks? So I don't really have a plan to. I know St. Vincent is not making me self-quarantine. They said that as long as I wear a mask and I'm not showing symptoms, which we have to wear masks at work all the time anyway, and as long as I'm not doing anything that could potentially put me at a high-risk exposure, like not wearing my PPE in a COVID room here, which I would never do, then I don't have to self-quarantine there. As far as my family, I have, my husband's a surgeon, and we have a 5-year-old. As far as them, I might self-quarantine. I think 14 days is a little excessive. Like the average onset after exposure, I think, is like 3 to 5 days. So we have talked about me staying in a hotel when I first get back for a few days. The Hilton is donating rooms to healthcare workers, so I may be staying at one of the Hilton properties, like the DoubleTree or wherever. I don't even know what Hiltons we have in Evansville. I know there's a DoubleTree, but other than that, either way, so I might be doing that, staying at a hotel for a couple days, just to make sure I don't get sick.
Yeah. Is there anything I didn't ask that you think is important to mention?
My parents live in Georgia, and I grew up in Atlanta, and I know Governor Kemp is opening Georgia, and my mom, I was like, Mom, if you leave, I will come down there and tie you in our house, because I don't know, just like seeing it with my own eyes, like just like the massive devastation. Like I just can't imagine what's going to happen when everybody's out and about and spreading it even more and more people get sick.
Yeah.
So I don't know, like stay home, don't go anywhere, like only go to the places that you need to. I mean, I know it's hard, like, oh my gosh, it's so hard. I was going crazy with my kid at home. And I love him very much. But, I mean, kids are going nuts. Parents are going nuts. Like, it's hard. People are unemployed. I get it. But at the same time, it's like, oh my gosh, people are dying